Workers at Chris Hani Baragwanath Hospital are staging a picket. They're unhappy about budget cuts at the facility, saying it will lead to job cuts. Workers also say it will affect the quality of service they're providing. eNCA reporter Slindelo Masikane is there and joins us now. Slindelo, we caught a bit of the the briefing or address by one of the staff members a bit earlier. What exactly are most of the issues?
Well, what we saw happening from around 11 till 12 this morning was a picket by doctors and some of the healthcare workers here at Chris Hani Baragwanath Hospital, and they were highlighting the issue that come the end of March, the 31st of March, some 819 employees are going to be without jobs, meaning that the hospital itself is going to be once more under-resourced. But also the issue that they were highlighting is that the hospital itself is already short-staffed, and the 819 employees that were hired during the height of the COVID-19 pandemic have been quite a helpful implementation to the hospital, saying that not only are they assisting when it comes to assisting patients that come in with COVID-19 and helping them recover in the wards, but they also assist in many other areas. We spoke to a number of the doctors here at the hospital who say that, but Chris Hani Baragwanath is the third largest hospital on the continent, and when you look at the services it provides not only to the community here in Soweto but to many of the hospitals in and around Gauteng, then you can imagine that the 819 workers who were employed have been really an added skill that's been needed here at the hospital. And so this picket is just one of many that's going to be taking place here, and the doctors, Professor Madi in particular, who works at the Wits Health Sciences Department, says that it seems that there's really a lack of leadership and foresight at the Department of Health, saying that the leadership there, it seems that there needs to be a change, because how on earth do you terminate 819 contracts knowing very well how much this hospital needs them?
I don't know if you were able to engage perhaps on a one-on-one with one of the staff members to actually interrogate the wording of the contract itself, because in as much as we have spoken or highlighted the shortages, I mean, there could be just the technicality that empowers government at this point to actually let go of the staff. So have they been able to stress to you if it was worded in such a way that it is in fact an interim sort of employment, they're only here for the specific period from time X to Y? Can you perhaps elaborate on that? Has anybody stated anything?
Certainly that is the case. These were fixed-term contracts that were constantly renewed, especially in light of how the COVID-19 pandemic was progressing. We know now that it seems the numbers, are stable. There's not a lot of, patients being admitted who have very serious symptoms. But what the hospital staff, what they were saying today is that despite the fact that these doctors were hired to deal with patients that have COVID-19, they can still, bring value to the hospital and continue to operate, because what they were saying is that Chris Hani Baragwanath is already understaffed even before the 819 contract employees were brought to the hospital. Already the hospital itself was not coping with the sheer number of patients that it receives. So what they're saying is that instead of terminating these contracts, let's find a way to absorb them into the system so that they can continue to be of assistance to not only the permanent staff here, but patients as well. What Professor Madi also highlighted was that because there's been so much attention brought towards COVID-19 and patients, who have COVID-19 are treated as a preference, should I say, then there's been a neglect on other diseases. And so what these doctors would be helping the hospital deal with is that burden of disease that's going to come after the COVID-19 pandemic is over, according to Professor Madi, of course.
All right. Slindelo, thank you very much for that update. That was eNCA's reporter Slindelo Masikane.